Last year, while we pay the highest prices in the world for prescription drugs, pharmaceutical industry, 6 major companies, made $69 billion in profit. So they're ripping us off right and left, and they use their profits along with their friends in the insurance industry to make sure that we don't pass Medicare for all. And by the way, in the Medicare for All program, nobody in America will pay more than $200 a year for the prescription drugs they need. End of discussion. Medicare for All will also, we're going to expand Medicare, and I hope the elderly people hear this. Right now, Medicare is a strong program, but it has its limitations, and we're going to expand it. Right now, Medicare does not cover hearing aids. We're going to cover hearing aids. Doesn't cover dental care. Doesn't cover eyeglasses. Does not cover home health care. And we're going to cover all of those important needs. Now, I have been attacked. Oh, Bernie, how are you going to pay for this? Because we just love the idea of private insurance. Everybody we know loves their private insurance company. Well, not anybody I have talked to. But I suppose somebody must, but I just haven't met that person. But right now, how do we pay for health care? Well, you pay through taxes and Medicare and Medicaid and all that stuff. But aside from that, you pay for it through your premiums. Spoke to a woman in Manchester a couple of months ago. She was in her 50s, I think. She was paying $1,700 a month in premiums. That's high. All right, but that's what she was paying, plus prescription drug costs. What are people paying a month here in premiums? Anyone know? $300 a month. What? $2,600? $2,600 a month. All right. All right, what else are people paying? $2,600 a month, that's God, $30,000 a year, right, for your health care. That's a bargain. What else are people paying in premiums? Anyone know? Okay. $500 a month, that's $6,000 a year. Do you have a deductible? Okay. So there's $6,000, you got a deductible, you got out-of-pocket expenses, you got prescription drug costs. All right. So I want you to know, one of the ways we are going to pay for Medicare for All, it's not free. Healthcare is an expensive proposition. We are going to have a tax, a 4% tax. First of all, we're eliminating all your premiums. Ma'am, that $2,600 a month is gone. All right? Your deductibles are gone. You ain't going to pay more than $200 a year for prescription, no out-of-pocket expenses, okay? But you are going to pay something. I got to. It's not free. It's not free. So what... What we will do is have a 4% tax on income, exempting the first $29,000. All right, good. You're better at arithmetic than I am. Because what that means is if you are that average family in the middle, who makes $60,000 a year, that means we're going to tax you on $31,000 at 4%, which is about $1,200 a year for comprehensive health care. How's that? And your employer will also be paying substantially less for healthcare, which means more money available for wage increases. Now, how do we do that? What are we, magicians? How do we do it? This is how we do it. For a start, we end the $100 billion a year in profiteering that now takes place from the healthcare industry. That's gone. But even more importantly than now, we have the most wasteful and bureaucratic and dysfunctional system in the world. And what that means in this room of, what we got, 300 people here, there are probably dozens and dozens and dozens of different healthcare plans. You got a $5,000 deductible, you got a $10,000, you're in this network, you're in that network. Your prescription drugs are covered, your prescription drugs are not covered. And on it goes. To administer this system of thousands of separate plans requires hundreds and hundreds and hundreds of billions of dollars in administrative costs. Every time you're on the phone, arguing with an insurance company. That happens once or twice, right? Telling them that, in fact, you do have coverage for the procedure that you need. You're paying for the guy at the other end of the phone telling you that you don't. You are paying the millions and millions of dollars in salaries for the people who sit at the head, the CEOs of the insurance companies. So by eliminating all of that administrative waste and having a very simple system, here's the system. And it's not a radical idea, it's what exists in Canada. Anybody know what happens if you end up in Canada for a month in a hospital after a difficult surgery? How much is the cost? Zero. It's not a radical idea. You go to any doctor you want. That program is wildly popular in Canada, supported by even the most conservative people in that country. All right? And they spend half as much per person as we do. All right? Because their system is simple. You got a little card. Card will say Medicare for all. You go to any doctor you want. You go to the hospital when you want. You don't take out your wallet. You don't take out your credit card. And you end up spending, as a citizen in this country, a fraction of what you're currently spending, because we believe that the function of healthcare is to guarantee healthcare to all people as a right, not to make huge profits for the healthcare industry. So when you see the ads here in New Hampshire, and they are surely coming, they'll be on your television, they'll be on your radio, they'll be on the internet, they'll be in your newspapers. Big ads. Bernie Sanders wants to destroy the American healthcare system. Terrible, terrible, terrible. Understand that it is the insurance companies and the drug companies who are paying for those ads. And what this whole debate is about is whether or not they are going to continue making tens of billions in profits while so many of our people are uninsured and underinsured. And whether they like it or not, history is on our side. We will win this fight.